In the intensive care unit, routines exist. What are the routines for nurses and nursing technicians? So, in this video, I'm going to talk a little about the nursing technician's routine. If you're a nurse, it's very important for you to understand what the technician's routine is. Because you are the leader, so you need to understand what they do, so you can start thinking about how you're going to improve your leadership. By the way, don't forget to like and share, subscribe if you want to become a specialist. Besides the title, come here to IPS. All right, let's go. The first thing you need to understand is that as a nursing technician, you already have some routines that are pretty much set for any intensive care unit you go to. First, you're going to take care of 2 patients. In some very rare cases, at least it's supposed to be rare, not the rule, you might take care of 3 patients, okay? The idea is that you take care of 2 patients. According to COFIM, according to RDC 7, and according to several guidelines and regulations, you take care of 2 beds. So, the first point we need to take into consideration is this. Your bed may be occupied or not, your bed occupied or not, regardless. He will have 4 infusion pumps, he will have a multi-parameter monitor, so whether you like it or not, a bed will always have these mandatory materials. So 4 infusion pumps, make a note of that, and a multi-parameter monitor, mechanical ventilator. It's not standard for every bed, of course, it will only be there when needed. There will be a gas panel there, because it's mandatory to have a gas panel with oxygen, compressed air, and vacuum at the head of the bed. That's the basic setup for all the beds there. But what is your routine? So the first step is that you will take over the shift for 2 patients. For example, you're assigned to beds 1 and 2 or 1 and 3, something like that. You'll only take over the shift for the beds you're assigned, like 1 and 2 or 1 and 3, depending on your responsibility in the unit. So what does it mean to take over the shift? You arrive, the other technician arrives and will hand it over to you. What happened in the last 6, 12 or 24 hours, usually 12 hours or maybe 6, it depends on the schedule. He tells you everything that happened during that shift and he will give you important points. Look, I started this norepinephrine and so on, so he will tell you why. Because there are some recommendations. For example, we change the vasoactive drug every 24 hours or sooner if it runs out. Alright, so he will tell you what time he started the sedative and what time he started the vasoactive drug. If the patient was on antibiotics, given antibiotics, had problems or changes, or if a new antibiotic will start, he will let you know. So, the routine is based on first receiving the shift handover from the other technician. And then he will tell you if there are any pending tasks for you to do, in case there are any, or any alerts for you. During my shift, we didn't change the vasoactive drug, so it's likely to happen during yours. If that doesn't happen, it's probably because this person doesn't have the routine of handing over the shift. That way you'll get the bottle, go there and get the bottle and read it, okay? This 4 fluid was set up yesterday at this time and will stay for up to 24 hours. I have this amount here, I'll have to set up an 4 for this patient, I'll take a look at the prescription and so on. So it's really important that you truly understand your importance there as part of the routine. So as a routine, this is basic. Receive the shift and check the solutions. These are the solutions which are drugs, specifically vasoactive drugs and antibiotics. The patient could be on a diet, but there isn't one here, right? They might be on an enteral or parenteral diet. So these solutions are something important for you to check as a routine. Every time you admit a patient there, you should already take a look at everything because there's something else important as a routine. Check the bed. Why? Because when you take a look at the bed, you see things that need to be done there. This doesn't look right. Oh, this got dirty. Why did it get dirty? Am I supposed to give the bath? The patient had one, but they're still dirty. Colleague, what happened? Why are they dirty after a bath? Oh, they couldn't take a bath because something happened. XYZ. All right, so this patient here, I'm going to have to give them a bath and all that. You get this information during the shift handover, but that's why you can't just take over the shift at the counter. You're not looking at the patient's bed because maybe there are things he doesn't mention or he forgot or he could. There are even some who act in bad faith. He doesn't tell you, and when you get to the bed, you look and you say, wow, I'm going to have to do this, that, and the other. He didn't mention any of that. And maybe it was something you weren't even planning to do, because there's nothing better than planning the care you need to provide for your patient. From the moment you already know how your patient is, you know if your shift is going to be tougher or not from the point of view of what needs to be done. For example, I'll give you a piece of information for the rest of your life if your patient is here for an exam. It's going to be a tough shift, at least that bed is already going to be a more complex one. Why? For him to leave the bed? You have to anticipate some things or do things afterwards. What can be done before, what can be done after? You have another patient, you have to alternate the other patient's tasks during the time you're going to the exam and coming back. In other words, taking a patient out of bed seems like it's quick to do a computed tomography scan or something like that. That takes a lot of time to organize, so when you see the bed, you know everything must be done. You don't need to give a bath, but you must change something. If a physical therapist is coming or your shift overlaps with visiting hours, the bed must be ready as a sign of respect. Handle the patient as little as possible, only when it's really necessary. So, look at how many things you already need to have in your mind, like routine and waiting. Then, those who work during the day will have visits. In the afternoon, your shift goes on, it extends into the afternoon, it extends. So, you have a short amount of time because when it's time for visits, you have to leave that bed for the visit. It's tough for family members to wait for visiting hours, especially when you're told they might be delayed, cancelled, or shortened. So, it's important in your organization to understand what you have to do for the visit. For the patient who has a bath in the same way, Lupa is going to have a bath, man, so I'll have to get things ready soon for the bath. Don't leave the bath for the end of your shift. The bath has to be done as soon as possible. Okay, that's basically it. Now, if you want more details about each thing during the shift, changing electrodes, changing equipment, the issue of central access, the care you need to take with it, all the care you want, right here, I want it, Professor. Talk more specifically about the technician there in the intensive care unit, more things I need to know, and I'll make a more in-depth video on this topic for you. Okay?